Hi, I'm Jamie, and the disorder that I was assigned is acute myeloid leukemia. It's a stem cell disorder, and acute means that it can progress quickly and it could be fatal, and myeloid is the type of cell that the leukemia starts from. It starts in your bone marrow, and in most cases it moves to your blood and then to other parts of the body, like your liver, your spleen, and your central nervous system. A couple causes is a shortage of normal blood cells. It occurs when your leukemia cells crowd regular blood-making cells in your bone marrow. These shortages show up in your blood tests and can cause symptoms. Translocations are the most common DNA change that can lead to leukemia. That's when part of the chromosome detaches and it attaches to a different chromosome and affects other genes. This can occur over a lifetime. It usually doesn't happen before birth. Some signs and symptoms of AML are weight loss, fatigue, night sweats, and loss of appetite. These are normally just the first general signs and symptoms, and then that can lead to anemia, which is low red blood cells that carry oxygen to your body. And those symptoms are tiredness, weakness, feeling cold, dizzy, headaches, and shortness of breath. And another sign and symptom is low white blood cells, and that can cause infection because there's nothing to fight it off. And some of those signs and symptoms are headache, one-sided weakness, slurred speech, sleepiness, and confusion. For the diagnosis, if your signs and symptoms may lead to leukemia, the doctor will request your medical history and then see how long you've had the symptoms, and then he will look at your risk factors. The doctor will look at your eyes, skin, mouth, lymph nodes, liver, and your spleen. If there is any reason that he might think that this might lead to leukemia, he will test your blood, and then he will probably send you to a hematologist. They also will take blood and bone marrow samples from your pelvic bone, and then they also take a sample from your spinal fluid because sometimes it spreads there. And then there's also routine microscopic exams that they test the size and the shape of your blood cells. And they also have x-rays, CT scans, and MRIs. Some risk factors for AML is smoking, certain chemicals, radiation exposure, blood disorders, genetic syndromes, family history, gender, and your age. Some treatment is, the main one for AML is chemo, and it can be followed up by a stem cell transplant, and then in some special cases, surgery might be required, or even radiation might be an option as well. The prevalence of AML, last year in the U.S. alone, there was 19,950 people that were diagnosed with it. 11,000 of those were men, and 8,000 of those were women. Men and boys, and then also women and younger girls as well. And then as far as deaths go, there were 10,000 last year in the U.S. 59 of those were men and kids. 5,900 were men and kids, and then 4,400 were women and girls. The developmental age I chose was ages 6 to 12. And I focused on three of the psychologists, Freud, Erikson, and Piaget. Freud's developmental stage for this was erogenous zone. This is like their sexual feelings are inactive. For Erikson, his stage is industry versus inferiority, and Piaget, concrete operational. The physical development of these stages, the children are very active and they enjoy play and physical activity. Their muscle and motor skills are still incomplete, and this can limit what they can accomplish. Their motor skills, hand-eye coordination, and their growth is very rapid in this stage. Girls develop way quicker and earlier than boys do. The erogenous zone for Freud's stage, this begins around school. Starting school, the kids become more active with their peers. For the emotional development, Erikson explains that they might have problems with competence and their self-esteem. Primary grade students become more emotionally sensitive and easily hurt by criticism, but they strongly react to appraisal. For the cognitive stage, Erikson said that they are capable of learning, creating, accomplishing skills, and knowledge, and they're very social in this stage. Freud said that they become more interested in their peers' hobbies, and this evolves a lot more over the next 4 to 5 years. They also start to develop simple math, reading, and writing skills. They also start to think for themselves. They speak up in class, and they do a lot better with tasks that are short and less demanding. Negative effects of AML for this age group. The chemo can cause heart and lung problems later in life. It affects their learning because it also has negative effects on their brain. It also stunts their growth, causes fertility issues, and osteoporosis, which is thinning of the bones. Some hospitalization issues for this age group. They have limited visitors and no privacy. This could cause them to miss their parents. They're also missing out on school, and they don't get to see their friends as much. This also leads to anxiety, which leads to bedwetting and then an altered body image. Some interventions that I came up with for this age group, I found this book online that's called the ABC Book of Cancer, and it's about a little girl who describes her experience while she was battling cancer. She uses each letter of the alphabet, and I found that it was really helpful because it describes what she went through really well. And there's also another book called Stevie's New Blood, which I thought did a great job explaining to kids with leukemia. And then what I thought I could do is walk them through the hospital and give them tours and introduce them to the techs that will be doing their x-rays, CTs, MRIs, and things like that. They're big on board games in this stage, and so I figured I could make up some games about their surgery prep to help them learn about what they're going to go through. Also, activities that promote discussion of their body image and their issues. Since they're already dealing with low self-esteem, I figured I could make them feel better by giving them makeovers, making them jewelry, hats, or shirts.